Good day everyone! I am Dr. Tim Lopez and now we will be performing a focused physical abdominal examination on a patient. There will be 4 parts of this examination. First is the inspection, auscultation, percussion, and palpation. Now we will be doing the first part of the examination, which is inspection. As we look to our patient, we will properly drape the patient and we will let the patient raise his knees so that we may relieve any muscular abdominal tension. And as we do so, we will now check the abdomen of the patient. First, we will look for any skin discoloration, ecchymosis, jaundice. We would also like to check for any signs of previous surgery such as scars and the like. And as we can see, everything is normal. Everything is normal. Second is we would also like to check for the contour of the abdomen. It's either flat, scaphoid, or globular. And as you can see, the contour of the patient is flat. We would also like to check for the umbilicus of the patient. Is it everted? Are there any presence of periumbilical veins? Are there any presence of Sister Mary Joseph nodules? And as you can see, there are none. We would also like to check for any visible peristalsis and pulsation in the abdomen of the patient, and as we can see, there are none. So for the inspection, for the patient, everything is normal. Now we will be doing the second part of the physical examination, which is auscultation. We will be checking for a irregular rate of 5 to 35 per minute of clicks and gurgles in each quadrant of the patient has normal active bowel sounds with around 34 to 35 clicks and gurgles per minute. And now, we will be doing the third part of our physical examination, which is percussion. And as we expect that in the abdomen, everything is tympanic except in the right upper quadrant where the liver is located, and we would be expecting a dull note. As we have checked each quadrant of the patient's abdomen, we can say that everything is normal, and we can hear that in the right upper quadrant, there is a dull note. Now, we will be going on the last part of our physical examination, which is palpation. We would like to ask the patient first if he is experiencing any abdominal pain so that we may palpate on the part of the abdomen farthest from that localization of the pain. Sir, may nararamdaman po ba kayong sakit ng tiyan ngayon? The patient does not experience any abdominal pain, so we may proceed in the normal method of palpation. We will be doing a single hand method wherein there are 2 parts, the light palpation and the deep palpation. Now, we will be doing the deep palpation. We check if there are presence of any muscle spasms, fluids, are there any masses, or are there any tenderness. And as what we have done, everything is normal. Now, we will be doing the last part of our abdominal examination, which is the digital rectal examination. This is a very important part of the physical examination because a lot can be assessed in the rectum itself. We can assess for any presence of tumors, if the patient is complaining with hematochezia, And we would also like to check if there the adjacent organs that can be felt within the rectum, such as if the patient is a male, the prostate gland. Sir, pwede na po tayo magsimula sa digital rectal examination. First, properly drape the patient so that only the rectum part can be seen. Sir, ipapasok ko na. Okay lang ba? Pasok ko na. 1, 2, Sir, wag niyong pigilan, sir. Sir.
Gari!
Ano yun? Sir, wag niyo pong higpitan. Sir. Okay. Parang normal naman po yung Sir, wag niyo pong paikutin, sir. Wag niyo pong paikutin. Okay. Ilalabas ko na, sir. And now, this is a fault of at my end because I did not wear any gloves. And as you can see, there is a presence of soiling. It is also a fault of the patient at his end because he did not evacuate his bowel before doing digital rectal examination. We would also like to check if the soiling, it's kinda oily in consistency. The smell is ammoniac.
No! God, please, no!
It tastes like shit. That would be all. Thank you for coming in my clinic, and I hope that you have learned something today.